If you watched the news at all during the past flu season, you certainly saw her on the web or on television. The county's public health officer, Dr. Wilma Wooten. Let's get to know her now and see how she got her start.
Well, in simple terms, I'm the doctor for the County of San Diego. My primary job is to make sure that we take care of the residents of San Diego. In the 1850s, when San Diego first began, public health was primarily related to keeping the streets clean by keeping horse manure off of the streets and making sure that sanitation was proper so that people wouldn't get sick. Well, infectious disease is a primary part of what it is that public health does in the county, making sure that we're monitoring certain communicable diseases, making sure that people get their shots so that they can be protected against common preventable infectious diseases. This current position as public health officer has been the most challenging, but it's also been the most rewarding. Every year that I've been the public health officer, I've had a disaster. From 2007 being the wildfires, 2008 we had the measles outbreak, and 2009 H1N1 pandemic influenza. This is a novel influenza virus, a virus for which people do not have immunity. The new influenza H1N1 virus, previously referred to as swine flu virus. We let the public know where the cases were so that people can get their children vaccinated. While it is hard, it is challenging, it is rewarding at the same time because you have the benefit of knowing that you're not helping just one person, but you're helping all of the residents of San Diego. Well, I grew up in rural Alabama, a town called Thomaston, and there were only 900 people. In my high school senior class, there were only 34 people and I was the valedictorian. Around the 8th grade, I met a graduate from my high school who was a physician, and that really was where my interest in becoming a physician was born. It spoke to my sense of dedication and nurturing and just trying to help others. And from that point on, that was my focus in life, was to go to medical school. I applied to Spelman College and majored in biology. And ultimately, I ended up in Chapel Hill, North Carolina. I obtained my master's in public health and then medical school degree from Chapel Hill School of Medicine. While in medical school, I got the travel bug because one of my electives was in obstetrics and gynecology, and I traveled to England to complete that particular elective. That really was the first time I had ever traveled out of the U.S. And from that point on, my eyes were opened about the opportunities for traveling, and traveling at the same time giving back to others. I've traveled to Jamaica, to Ghana, and to Kenya to participate in medical missions. Volunteering to help others, whether it's at home or whether it's in other countries, it's a rewarding and fulfilling experience. You know that you have helped someone else feel better, but by doing that, you make yourself feel good as well. Words of advice for children that have witnessed or experienced difficulty. I grew up very poor. I grew up in rural Alabama. My great-grandparents had a 5th and 6th grade education. So I really am the first person in my family to go to college. And it was never a thought that I could not go to college because it was the goal that I set for myself. And I didn't listen or allow anyone to tell me that I could not. So as long as you have a goal and an opportunity, really nothing is impossible. By just expressing an interest or a desire to do more or to attain more, people will take an interest in you and support you in your dreams.
Recently, the county held a career day for teens who were coping with homelessness. This video was part of a program designed to encourage teens to prepare for a bright future. For CTN.org, I'm Michael Russo.